In this session, we will be discussing about the different exercise program for the back muscles. So before going through the different exercise program, we'll go through which are the different muscles, important muscles seen in the back, which make the different back movements. So the muscles can be classified into three different groups: a superficial group, an intermediate group, and a deep muscle group. Superficial and intermediate muscles are extrinsic muscles, and deep muscles are intrinsic muscles seen in the back. Superficial muscle groups, we will go through the different superficial muscle groups. So the important muscles seen in the superficial muscle groups are trapezius, latissimus dorsi, levator scapula, rhomboides major, and rhomboides minor are the superficial muscles seen on the back. So these superficial muscles are the muscles which connect the limb to the axial skeleton, that is upper limb and lower limb to the axial skeleton. And all these superficial muscles are innervated by ventral rami or the cranial nerve 11. So these are the superficial muscle group, that is trapezius, latissimus dorsi, levator scapula, rhomboides major, and rhomboides minor. Then there is just after the superficial group, deep to the superficial group, there is an intermediate group of muscles. These are intermediate intrinsic muscles. So these muscles are the serratus posterior group of muscles. That is, it includes serratus posterior superior and serratus posterior inferior. Now comes the intrinsic back, that is intrinsic muscle, and these are the deep muscles of the back. So these are the iliocostalis, longissimus, spinalis, semispinalis, and multifidus muscle. Now we will go through the different muscles seen in the back individually. The first muscle and the most superficial muscle is the trapezius muscle, and is the most superficial muscles, and it originates from the upper side of the cervical region, and it comes down from there. So origin is medial 1/3 of the superior nuchal line, ligamentum nuchae, external occipital protuberance, spinous process of the C7 to T12 vertebra. So we will go through the origin of the trapezius muscle again. That is medial 1/3 of the superior nuchal line, external occipital protuberance, ligamentum nuchae, and spinous processes of the C7 and T12 vertebra. And it's having three insertions. One is at the clavicle, that is lateral 1/3 of the clavicle, then acromion process and spine of the scapula. Now the action of the trapezius is, its action is on the scapular region. Action, elevation and depression of the scapula, plus rotation of the scapula, superior rotation of the scapula and retraction of the scapula. So the action of the trapezius are the elevation, depression, rotation and retraction of the scapula and its innervation, the nerve supply. So it's having two nerve supply, a motor nerve supply and a sensory nerve supply. Motor nerves from the spinal accessory nerve. And the second is the sensory nerve, that is proprioceptive nerves, that is from C3 and C4. Then next muscle seen on the lower thoracic and the lumbar region or back is the latissimus dorsi muscle. It is also an important muscle in the lower thoracic and the lumbar region, and its origin from the vertebral spines of the T7 to sacrum, posterior 1/3 of the iliac crest, and lower 3rd or 4th ribs, and inferior angle of the scapula. And it is inserted at the floor of the intertubercular groove, that is in the humerus. It goes and attached to the humerus. Between the tubercle there is an intertubercular groove, and in the intertubercular groove it is inserted. So as it is attached to the upper limb, so its main function is the movements of the upper limb. That is, its extension and rotation of the arm is the main function of the latissimus dorsi. So its innervation is from the C7 and C7 and 8. That is thoracodorsal nerve is the nerve supply. It is from the posterior cord of the brachial plexus. The third type of muscle seen, the third muscle seen in the back region is the levator scapula muscle. That is, by the name itself, we can understand it is a muscle which elevates the scapula, and its origin is from the transverse process of the C1 to C4 vertebra, and it is inserted on the medial border of the scapula from the superior angle to the spine. Action is elevation of the scapula, and innervation is the dorsal scapular nerve, and the upper part of the muscle receives from the branches of C3 and C4. Next important muscle is the rhomboides major. Rhomboides major, its origin is from the spines of the T12 to T2 to T5 vertebra. So rhomboides major, its origin is from the spines of the vertebra T2 to T5, and it's inserted on the medial border of the scapula. So it is a connection between the vertebra and the scapula. So insertion is in the medial border of the scapula, inferior to the spine of the scapula. So again, as it is connected between the vertebra and the spine, so the main movement is again the movement of the scapula, that is retraction, elevation, rotation, and rotation of the scapula. And innervation is from the dorsal scapular nerve. Now rhomboides minor, that is origin is from the inferior end of the ligamentum nuchae, spines of the vertebra C7 to T1, and insertion is on the medial border of the scapula at the root of the spine of the scapula. Then action, again it is attached to the scapula, so its main action will be the movement of the scapula itself, the retraction, elevation and rotation of the scapula, and innervation is again dorsal scapular nerve. Now comes the second group of muscle. The muscles we discussed all are the superficial muscles, and comes the intermediate group of the muscle. These are the serratus posterior group of muscles. Serratus posterior group of muscles, it includes serratus posterior superior and serratus posterior inferior. You can see in the picture also this one. Origin from the ligamentum nuchae, spines of the vertebra C7 and T1, and it is inserted to the ribs. That is second to fifth rib, lateral to the angle of the rib. Its main function is elevation of the upper rib and its innervation from the branches of the ventral rami of the spinal nerve T1 to T4. Next muscle is the serratus posterior inferior, and this is the next intermediate muscle. So the next muscle is the serratus posterior inferior, and is the second muscle of the intermediate group, and its origin from the thoracolumbar fascia and the spines of the vertebra T11 to T12 and L1 to L2, and its insertion is again on the ribs, that is 9 to 12 ribs, again lateral to the angles. So its main action is pull down the lower ribs. Innervation is from the branches of the ventral rami of the spinal nerve T9 to T12. Next muscle is the deep group of muscles, deep muscles. The first one is the iliocostalis muscle, and it is from the iliac crest and sacrum, its origin and insertion to that is ilium and costalis, that is ilium to ribs, that is iliac crest and sacrum to insertion to the angle of ribs. Action is again extension and lateral movement of the trunk and neck, and innervation is dorsal primary rami of the spinal nerves T4 and S spine. Other muscles are longissimus, spinalis, semispinalis, and multifidus. Erector spinae is another muscle seen on the lower back. It is an intrinsic muscle, and it is the extensor. It is considered as the extensor of the trunk, extensors of the trunk, and it can be divided into two groups. Erector spinae are some groups of muscles. It is divided into two groups, a longissimus thoracis group and iliocostalis group. Again, it can be classified as superficial and deep layers of muscle, erector spinae muscles. In this, longissimus thoracis, pars thoracis, and iliocostalis, pars thoracis, that is thoracic group, This is the superficial groove. And iliocostalis pars lumborum and longissimus thoracis pars lumborum. These are the deep muscle, that is lumborum group. That is lumbar group of muscles are the deep group of muscles. That is iliocostalis pars lumborum and longissimus thoracis pars lumborum are the deep muscles. And longissimus thoracis pars thoracis and iliocostalis pars thoracis are the superficial muscles. So these are the erector spinae. Next, another important muscle in the lower back region is the multifidus muscle. It is also an intrinsic muscle. It is consists of a number of fleshy groups of muscle and tendinous fasciculae which fill up the groove and on the either side of the spine and spinous processes of the vertebra and from the sacrum to the axis. In this session, we will be just going through the different exercises which can be done on your back muscle. For mainly two purposes. For two purposes, we are doing the exercises on the back. The first one is the strengthening purposes. So we are doing the strengthening of the back muscles by doing different types of exercises. This is called strengthening exercises. Next thing is that stretching of the muscles of the back. That is, these are considered as a group of stretching exercises. So main function of this stretching exercise is that prevention of injury. So that there are lots of, mainly in different games, there are lots of injuries usually happens in the back muscles. There are lots of back strain happens and other back injuries also there. So this stretching exercises improves the flexibility of the back muscle and decreases the chance of injuries. And strengthening exercises, it improves the performance and improves the strength of the muscles. So we'll go through the different exercises of the back muscles. So it may include either stretching part or strengthening part or a combined part. We'll go through different exercises. Pelvic tilt. The first exercise is we'll go through the pelvic tilt. The first position for the pelvic tilt should be, the person should be lie on the back on the table, lie on the with his back on the table on a firm surface or a firm surface. Your feet should be flat on the table. The feet should be flat on the table and the knees should be bent. This is the initial position of the person. Now we are asking him to do the pelvic tilt by saying that you push your pelvis down by little bit up. That is, push your back. The action is push your back down to the table by pulling your abdominal muscles. So do it. This is the pelvic tilt exercise. So he is pushing the pelvis down and little bit lifting up and pushing his pelvis down. So this is the pelvic tilt type of exercises. And he can breathe during there is no issues regarding the breathing. There is no need of holding the breath. And he hold the pelvis for 5 to 10 seconds. Second type of exercise is knee to chest. In this, person again should be flat on. He should be flat on the surface. He should be lying on over the table or a flat surfaces. And we are asking the subject to bend the knees. We are asking the subject to bend the knees and clasp the lower part of the upper part of the thigh and move towards his chest. Moving towards the chest, this will give a stretching effect on the lower back muscles and the gluteus muscles. And he can switch then after holding it for 30 seconds, he can switch to the other leg. You can do over this leg. You can switch to the other legs and hold it for 30 seconds and do the other leg. He can do for the other leg. This exercise is knee to chest exercise and it gives stretching of the back muscles and along with the gluteus muscles. The next type of exercise is the hip rolling. The person should be flat on the surface, lie on your back on the table on a flat surfaces, and we are asking the subject to bend his knees. the knees has to be bent and feet should be flat on the table. Now, you are asking the subject to cross his arms above the chest, cross his arm over the chest. Now, you are asking the subject to turn his chest and upper side of the body towards the right side, and at the same time, his lower side, the legs should go to the opposite side. So, start doing it, and then the same thing can be done towards the left side also. Okay, towards the right side now. Then left side. So this is the hip rolling type of exercises. Next type of exercise is the cat and camel type of exercises. The person should be on his both arms and knees. That is all for position. And the person, we are asking the subject, he should be looking towards the floor only. And we are asking the subject to raise his lumbar region and as maximum as possible to make the position of a camel. So this is the camel type of exercise, and hold it for some time. And we are asking the subject to down his lumbar region and making the position of a camel. So this is the cat and camel exercises. So do the camel type of exercise again, lifting his lumbar trunk and making a camel position, and lowering the lumbar trunk and making a cat position. So this is the cat and camel type of exercises, and repeat it 2 or 3 times. When you repeat it 2 or 3, this is the cat type of exercise, this is the camel type of exercise, and next is cat. This is the cat and camel exercises. Next type of exercise is the pelvic lift. Here we are lifting the pelvic part. So the person should be, first of all, the person should be we should be lying on the floor, and we are asking the person to bend the subject should bend his knees, and the feet should be flat on the surface. Now we are asking the subject to lift his pelvis as much as possible. So we are asking him to lift his pelvis as much as possible, and hold for 5 to 10 seconds, and we are asking him to relax and goes to the original position. So go to the original position, and he can repeat 4 or 5 times the same exercises. And no need to hold the breath also, he can breathe during the exercises. Type of exercises is to strengthen the lower abdominal, especially the abdominal muscles. So abdominal muscles, especially, they do the flexion movement of the vertebral column. So the strengthening of the abdominal muscles are very important in order to avoid injuries and in order to avoid the back pain, especially in case of back pain also. So the exercises, the starting should be that we are asking the first thing is that we are asking the person to do a knee to chest exercises. So do the knee to chest exercise. Return to its original position. Then this one. Return to its original position. Then straight. The person should be again straight, and we are asking him to lift his one leg without bending his knee and holding for some seconds. Holding for 5 to 10 seconds. And he can return to its original position, and he can lift the opposite leg and hold for a while again, 5 to 10 seconds, and he can count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 for 10 seconds, and goes to his normal position. Again he can repeat it, and in the next stage of exercise is that he can lift both legs together. and hold for a while. He can count up to 10 and hold for 5 to 10 seconds and go to its normal position again. And we are asking this, then the upper torso has to be lifted now. And holding it for 10 to 5 to 10 seconds again, and she can go back to the normal position. And in the next stage of this exercise, we are asking him to lift the upper and lower torso, upper limb, upper side and lower side, and we are asking him to hold it for 5 to 10 seconds and goes to its normal position, its original position. He will be relaxed. Again, he can continue the exercise. So this type of exercise is to improve the abdominal muscle tone and strength of the abdominal muscles. Again, this exercise can be demonstrated again. We are asking the subject to lift the leg, to lift the one of his leg first and hold for some time and relax. Again, the opposite leg can be lifted. Down again. Then we are asking the subject to lift his both legs. It is the next stage of this exercise is both legs together, and it returns to its original position. Then we are asking the subject to lift his upper torso and go back to its original position. And the next stage of exercise is that he can lift both upper and lower torso and do and this will improve the abdominal muscle tone and improve the strength of the abdominal muscles. Especially, we studied the rectus abdominal muscle, especially the rectus abdominal, the strength and tone of the rectus abdominis muscle will be improved. Next type of exercise is the curl up type of exercises. It is the curl up type of exercise. It also to improve the abdominal muscle, to improve the tone and improve the strength of the abdominal muscles. For this type of exercise, the person should be flat on the surface again. He should lie on a flat surface, and again we are asking him to bend his knees, and we are asking him to lift his arms over the table, and we are asking him to lift the upper torso, upper side of the body, and hold it for a while. Meanwhile he can count, and no need to hold the breath, and he can go back to his normal original position. He can do 4 or 5 sets this. Then in the second progression of this exercises, we are asking the subject to keep the hand close to the chest. Now, the same exercises, he can lift the upper side of the body, the chest and upper side of the body. Again, he can lift that side, upper side of the body, and hold it for a while. No need to hold the breath. He can take the breaths properly and hold it for a while, and he can go back to his normal position. So this type of exercise, again, it improves the strength of the abdominal muscle, especially the rectus abdominis muscle. In the next stage of exercises, he can keep both his hand above the head, or below the head, or above both his hands over the head, and he can lift the upper torso again, and he can go back to his normal position. So starting position is the all four position. This is the type of exercise here. This is the hip extension exercises, and starting position is the all four position. That is both hands and knees will be on the ground or over the table, and we are asking him to lift one of his leg without extending his knee. He is lifting his hip or extending his hip and holding it for a while, for 5 to 10 seconds, and going back to the original normal position, and do the same exercise in the opposite leg also. Return to the starting position, then he can return to the starting position. He can he can switch to the other leg again. exercise is the lying prone on in extension. That is, here the person will be lying prone over the flat surfaces as a flat surface or over the table. With the lying prone means the stomach will be over the table, and we are asking him to lift his upper torso or upper side with the upper side as maximum as possible without bending his elbows. So, and he can hold it for some time and then relax and repeat the exercise. Okay. This is known as lying prone in extension. Okay. Next type of exercise is the press up. That is, in this the person should be on again in the prone lying position, and his stomach will be on the over the floor, and we are asking the subject, we are asking the person to keep his palm under the chest or under the shoulders, and we are asking him to raise his upper torso and the pelvic region without lifting his knees. So hold it for 5 seconds, and he can go back to his normal position, original position, starting position, and repeat it 5 to 10 times. So this is called press up type of exercise. Welcome back. In this session, we will be discussing regarding the abdominal muscles. Which are the abdominal muscles and which are the different exercises to improve the tone and flexibility of the abdominal muscle. We will be discussing all these matters in this session. So before going through the different abdominal muscles, we will go through which are the functions of abdominal muscles. So these are the muscles seen in front and sides of the abdomen, and the main function is the movement and support of the trunk. So it is one of the main muscle which provides the core stability or the support for the trunk. And the another function is the movement, especially the flexion movement and lateral flexion and rotation movements. So the first, one of the main movement is the flexion movement of the trunk, and the other movements is the rotation and lateral flexion are the other movements which is done by the abdominal muscles. The second function of the abdominal muscle is it assists in breathing process. It is the secondary one of the important muscle in assisting in breathing process. And the third important function is these are the muscles which protect the inner organs in the abdominal area. We will go through the functions of the abdominal muscle again. The different movements done by the abdominal muscles are the flexion of the in the lumbar region, flexion, lateral flexion, and rotation. And it gives support to the trunk, and it gives protection to the inner organs, and it assists in breathing processes. Now, the anterior abdominal wall consists of 4 pairs of flat sheets of muscles. So there is a total 8 muscles are there, and there are 4 pairs of muscle. That is, the names of the muscles are the rectus abdominis, transverse abdominis, external oblique, and internal oblique. Now we will go through each muscles again. The first one is the rectus abdominal muscle. It is seen exactly in the anterior side, and rectus abdominis is the muscle. These are the 2 parallel muscles on the anterior side of the abdomen, 2 parallel muscles on the anterior side of the abdomen, separated by a medial band of connective tissue. So there are 2 pairs of muscle, rectus abdominal muscle, separated by a band of connective tissue. The name of the connective tissue is called linea alba. So these are rectus abdominal muscle, 2 pairs of muscles separated by linea alba. and its origin is from the pubic bone or pubis. And it goes upward and inserted into the xiphoid process or xiphi sternum and costal cartilages of 5th and 7th rib. So it starts from the pubis, it goes upward, and it is attached or inserted to the xiphi sternum and costal cartilage of 5th and 7th. That is 5th to 7th costal cartilages it is attached. Now, the main function as it is on the anterior side. So, the main function of the rectus abdominal muscle is the flexion of the entire vertebral column. That is, the movement is like this. The flexion of the entire vertebral column is the main function of the rectus abdominis muscle. So, rectus abdominal muscle, these are the two parallel muscle. So, this is the muscle which commonly in layman's terms, which commonly called as sixth pack. So, this muscle get hypertrophy after doing lots of extra exercise. We can get this muscle hypertrophied, and the hypertrophied muscle is commonly in layman term is known as six pack. So, these are two parallel muscle, and the main functions are flexion of the vertebral column. Now, the next three muscles, that is external oblique, internal oblique, and transverse abdominis. These are seen lateral to the rectus abdominis muscle, that is on the lateral side of the abdomen. These muscles, lateral and anterior side of the abdomen, that is lateral to the rectus abdominis, these three muscles are seen. The first one is external oblique. So, we will go through the external oblique. Its origin is from the external surface of the ribs of 5th to 12th ribs. So, its origin is external surface, you can see in the picture, the external surface of the rib 5 to 12. And it is inserted to the anterior iliac crest, abdominal aponeurosis to the linea alba. So, it is having two insertions. The first one is anterior iliac crest, and the second one is abdominal aponeurosis to linea alba. So, as it is a lateral muscle, so it helps in flexion, and it helps in rotation. It helps in flexion like this, and it helps in rotation, and as it is on the lateral side, it helps in lateral flexion also of the vertebral column. So, action of this muscle is flexion. The first one is flexion, then second one is rotation movement, and third one is lateral flexion of the vertebral column. Now, the nerve supply. The nerve supply is 8 to 12 intercostal nerves, and iliohyogastric nerve and ilioinguinal nerve. There are three nerve supplies. That is from the four intercostal nerves plus hyogastric nerve and ilioinguinal nerves. Next muscle is the internal oblique muscle. You can see in the picture its origin and insertion, it is obvious. So, origin is from the anterior iliac crest. Second origin is the lateral half of the inguinal ligament, and third is thoracolumbar fascia. So, it is having three origin: anterior iliac crest, lateral half of the inguinal ligament, and thoracolumbar fascia. And it is again inserted into the costal cartilages of the ribs 8 to 12 and abdominal aponeurosis of the linea alba. Again, if the function is almost same, again the function is flexion of the vertebral column, rotation of the vertebral column, and lateral flexion of the vertebral column. Again, its insertion, its nerve supply is almost similar. That is again 8 to 12 intercostal nerves, iliohyogastric, and ilioinguinal nerves are the nerve supply to these muscles. Next muscle is the transverse abdominis. Its origin is anterior iliac crest, lateral half of the inguinal ligament, thoracolumbar fascia, and cartilage of the ribs 6 to 12. So, it is having four origin: anterior iliac crest, lateral half of the inguinal ligament, thoracolumbar fascia, and cartilages of the ribs 6 to 12. Its insertion is abdominal aponeurosis to the linea alba, again symphysis sternum and pubic symphysis. So insertion is abdominal aponeurosis to the linea alba, symphysis sternum and pubic symphysis. So its main function is it compresses the abdomen. Compression of the abdomen is the main function of the transverse abdominis muscle. Nerve supply is 7 to 12 intercostals, iliohyogastric and ilioinguinal nerves. Now we will go through the different exercises of abdominal muscles. That is, these exercises are to improve the strength of the abdominal muscle and improve the tone of the abdominal muscle, because the weakness of this muscle causes the low back pain. So in the treatment of the low back pain and prevention of the low back pain, these abdominal exercises are very much important. The common type of exercises used are crunches. The crunches, then there are variations of the crunches. It may be a reverse crunch, it may be a twisting crunch, and it may be a cable crunch, it may be a bicycle crunch, it may be a ball crunch, then vertical leg crunch is there, long arm crunch is there. So this is the one of the commonly used exercise, the first type of exercise used to improve the strength and tone of the abdominal muscle, the crunches. And there are variations of the crunches are there, we will go through it later. And the second type of exercise commonly used is the sit-ups. The difference in the sit-up and crunch is that, in crunch, while performing the crunch, the lower back won't leave the floor in case of crunch. You can see in the picture of the sit-up, the lower back won't leave the floor in case of crunches, but in case of sit-up, the lower back, the person actually sits up from the lying position. Again, there are variations of the sit-up techniques, and we can improve the techniques and we can give more resistance to these techniques. Now, incline sit-up is another variation of this sit-up, that it uses gravity and the body weight, entire body weight, and it gives more resistance to the sit-up and gives more tonicity to the sit-up. And the another method is the leg raise. Leg raise also a very important exercise and usually prescribed exercise for the low back pain. In case of low back pain, it gives a lot of improvement to the tonicity and strength of the muscles. And there are different techniques. Captain's chair leg raise is another technique. There are different techniques of the leg raise. We will go through in the practical class regarding the different, we will show each technique in the practical class. Some of the important abdominal exercises. These are the exercises to improve the tone of the abdominal muscles. These type of exercises are given especially for the upper rectus abdominis muscle. We already discussed the rectus abdominal muscle is one of the major muscle on the anterior side of the abdomen. That is, this muscle is the main muscle which flexes the lumbar region and the trunk. So crunches starts with the person the athlete lying face upon the floor with the knees bent. So the person will be the knees bent and he will be lying face upon the floor with the knees bent. The movements begins by curling the shoulder towards the pelvis. Curling the shoulder towards the pelvis, the person can keep the hand behind or beside the neck or cross over the chest. So this is the technique of the crunches. This technique is used. We can do it 4 or 5 times. The techniques can be done 4 or 4 times. The crunches can be done. It improves the abdominal muscle. And the person can do the same exercise crossing the hand over the chest. So this is the crunch, and repeat it 3-4 times. Just show it 3-4 times. So hands either can be kept over the chest or it can be kept behind the neck or beside the neck, and the movement is done by curling the shoulders. The main movement is curling the shoulders towards the pelvis, so that it improves the tonicity of the, especially the rectus abdominis muscle, and along with the rectus abdominis muscle, it gives improve the tonicity and strength of the obliques and hip flexors also. So this is the most commonly used technique, crunches. And next, there are different techniques. You can see the different types of crunches in the photos, and there are different variations of the crunches. The one common variation is the reverse crunch. The reverse crunch is a type of crunch in which the leg, we are using more movement on the legs instead of the chest. The lower torso of the body, we can demonstrate it. The lower torso of the body, no. The lower torso of the body is flexed and move towards the chest, and there will be mild movement in the upper torso of the body. Just repeat it, relax. Repeat the movement. Please repeat the movement. So this is the reverse crunch. That is, the crunch is done by the legs instead of the chest. You can repeat 3 or 4 times. Please repeat the crunch again, reverse crunch. This is the reverse crunch. This technique is the reverse crunch, and it gives the strengthening. It does the strengthening and improves the tonicity of the rectus abdominis muscles. Another variation of the crunch is the twisting crunch, and in this crunch we are concentrating on the lateral muscles of the abdominal wall. That is, we studied there is a central muscle, rectus abdominis, and other 3 lateral muscles are there. The twisting crunch is a type of crunch in which we are just twisting. Instead of doing the straight, we are just twisting the motion. That is, it is performed by lifting one shoulder at a time. Instead of lifting the entire chest, we are lifting one shoulder at a time. Here, we are giving more emphasis on oblique muscles, obliques, that is, especially on the lateral side. So, please start doing the crunch, twisting crunch. Next type is the twisting crunch, and it is performed by lifting one shoulder at a time. We are giving the concentration, more emphasis on obliques muscle. So start doing the twist crunch. So here the person is performing by lifting one shoulder at a time. We are not lifting both shoulders. We are lifting one shoulder at a time, and the lift will be twisted. Instead of twist, the movement will be only on one shoulder, one side of the one side. It is good. Next is twisting crunch. It is performed by lifting one shoulder at a time. That is, more emphasis will be placed on the obliques. Start twisting crunch. Shoot. This is the twisting crunch, and one shoulder will be lifted. One side will be lifted more, and again this will be lateral side of the muscle will be more concentrated in this type of twisting crunch. It improves the tonicity and strength of the lateral muscles of the abdominal wall. Okay. Next variation of the crunch is the cable crunch. In the cable crunch, the resistance we are giving from an elastic or a elastic cable or a tubing which is kept above the head, and the subject hold the cable, and the elasticity of the cable, again the resistance is given by the elasticity of the cable, and keeping the arms stationary, use the abdominal muscles to pull the chest towards the floor. He tries to pull the chest against the elasticity of the cable and gives the resistance to the abdominal wall muscles by working against the cable or using the resistance of the cable. And this is another variation of the crunch called cable crunch. Next variation in the crunch is the bicycle crunch. In this, the initial position is the subject should be lying flat on the floor with the lower back pressed on the ground. The subject should be flat on the ground with lower back pressed on the ground. Then we are asking the subject or the subject put his hand beside of the head. So subject put his hand below or beside of the head. And now bring both knees up to about a 45-degree angle and slowly go through a bicycle pedal motion and touch the left elbow to the right knee and then right elbow to the left knee. So this is the bicycle type of crunch, and breathe evenly throughout the exercise. There is no need of holding the breath. So this is the bicycle type of bicycle crunch, and this is to improve both lateral and anterior muscles. Repeat 3-4 times. In the crunch is the ball crunch. So in here we are using a gym ball or gym ball for ball crunch. The subject should be lie on the ball, positioning it under the lower back. So the subject should lie on the ball, positioning it under the lower back. Cross the arms over the chest or place them behind the head. Either the person can cross the arms over the chest or place them behind the head. Contract the abdominal muscle to lift the torso off the ball and pulling the bottom of the rib cage down towards the hip. As curl up starts, keep the ball stable and ball shouldn't roll out. This is the ball crunch. This is another variation of the crunch technique. Next type of crunch is the vertical leg crunch. In this, the subject should lie on the floor and extend the legs straight up with the knees crossed. Extend the leg straight with the knees crossed. Then the subject can place both hands on the floor for the support, or he can either keep his hands arm crossed over the chest, or he can keep the hands behind the head also. Now we contract the abdominal muscles to lift the shoulder blades off the floor as through reaching your chest towards the feet. So try to lift we are asking the subject to lift to contract the abdominals to lift the upper torso and keep the legs in a fixed position, and imagine bringing your belly buttons towards your spine at the top of the movement. So this is another variation on the crunch, that is vertical leg crunch. Type of crunch is the long arm crunch. Here the subject will lie on a mat or a floor and extend the arms straight out behind the head with hands clasped. Arms should be, and keep the arm next to the ears. Now contract the abdominals and lift the shoulder blades off the floor. That is, upper shoulder torso should be lifted, and keep the arm straight and avoid straining of the neck. If you feel neck pain, take one hand behind the head, keeping the other arm extended. So this is the technique used for long arm crunch. That is, contract the abdominals and lift the shoulder blades off the floor with straightened arms. 2-3 times. Please do it 2-3 times. Next technique of improving the tonicity and strength of the abdominal muscle is that sit-up techniques. So we discussed regarding the crunch technique now, and the difference in the sit-up and crunch technique is that while performing crunch, the person is not leaving the floor. That is, upper back is not leaving the floor. But in sit-up, the person completely leaving the upper back from the lower back from the floor and completely sit on the ground. So the difference in sit-up and crunch is that while performing crunch, lower back won't leave the floor. Now the technique is that it begins with lying the back on the floor, typically with the arms crosses the chest or behind the head and the knees bent in an attempt to reduce the stress on the back muscles. And then elevating both upper and lower vertebra from the floor until everything superior to the buttock is not touching the ground. So this is the technique of sit-up technique. And either person can perform by keeping his arm behind the head or arms crossing the chest. These are the sit-up technique, and entire lower back is leaving the floor, and that is the difference between the crunch technique and the sit-up technique. So this is the sit-up technique. Now, in order to improve the resistance and increase the resistance and improve the techniques, there are other sit-up techniques like inclined sit-up technique is there. It uses complete gravity and weight of the body, so that more resistance will be given against the sit-up, and it improves the tone and the resistance, and it improves the strength of the muscle when compared to the normal sit-up techniques. So next type of exercise commonly used to strengthen the abdominal muscles and improve the tonicity tone of the muscle is the leg raise. Here we are it is a type of straight leg raise. We are asking the subject should be lying on the floor or a mat, relaxed, and we are asking the subject to raise one of his leg without bending the knees. Just raise your leg. And we are asking the subject to hold it for a while, 5 to 10 seconds. We are asking him to find out the timing, to count the time, 1, 2, 3, 4. And we are asking, then it will be relaxed. Then again he can continue this to 3 or 4 sets and switch into the opposite leg. So opposite leg can be again lifted straight without bending his knees and hold it for a while. And then after 5 to 10 seconds, relax and go to the starting position, and again continue, do for 3 to 4 sets. And then in the next progression or next stage of this exercise, the subject can raise both the legs together without bending his knees, and the upper torso should be relaxed on the mat, and hold it for a while, 5 to 10 seconds. And then relax and go to the starting position very slowly and gradually. Now he can continue the exercise 4 to 5 sets, and which will strengthen his abdominal muscles. Again, one more time. In the next stage of exercise, in this straight leg, in the same exercise, we are asking him to lift the upper torso, that is upper body. That is, usually we can do either his hand crossed over the chest, or he can keep the hand behind his head, or he can keep the hand straight. So this is at the different levels or different progression of the exercises. And this is the next stage of exercise. Either he can do it in the hands crossed, or keeping the hand below his head, or keeping the arm straight. Now in the next stage, we are asking to lift both the legs and the upper torso together and make the subject in a boat shape. And hold it for a while, hold it for 5 to 10 seconds, so that it gives good pressure over his abdominal muscle, and it increase the strength of the abdominal and improves the tonicity of the abdomen. So he can do it by straightening his hand. He can do it in the same exercises by keeping his hand behind the head. These are the different variations of the SLR. One more time. Okay, start. These are the different variations of the SLR. Okay. Now we will do this. We will show the exercise again, each step again. First of all, the subject is lifting his one leg and hold it for a while. and return to its original position again. Then subject's opposite leg, he will be lifting his opposite leg and holding it for a while and return to its starting position and lifting both legs together, holding it for a while, doing it for in the different sets, that is 4 to 5 sets. In the next stage, the person is lifting his upper torso, either hands crossed against the chest or hands keeping above the sides of the head or hands straightened. So in the next stage of this exercise, we are asking the subject to raise both his upper torso and legs and make a boat shape, that is straight leg raise. Another variations of the leg raise is the captain's chair leg raise. So it's using a special table chair called the captain's chair. And we are asking the subject to stand on the chair and grip the hand holds to stabilize the upper body. Then press the back against the pad and contract the abdominals to raise the leg and lift the knees towards the chest. Don't arch the back or sink the legs up. Slowly lower the back down and repeat it 3 to 4 sets for 12 to 16 repetitions. This is the next another type of leg raise exercise called captain's leg raise. In this session, we will be starting with some abdominal exercises. These are exercises which improve the tonicity, tone and strength of the abdominal muscles. We already discussed there are different regarding the different abdominal muscles, which is seen especially on the front and sides of the abdominal wall. A variety of exercises can be done to improve the tonicity and strength of the abdominal exercises. The different exercises include the crunches, the sit-ups, the leg raise, and these are the main exercises we are going to discuss here in this session. And the first one is regarding the crunches. It is one of the most common exercise used to improve the strength of the muscles, the abdominal muscles. And there are variety of the crunches, variations of crunches have been done. And the one important variation is the reverse crunch. In the reverse crunch, the crunch is done with the legs instead of chest. And another variation in the crunch is the twisting crunch. In this twisting crunch, the one shoulder is lifted and one shoulder is lifted at a time. It is to give more emphasis on oblique muscles. Usually the normal crunches is giving more emphasis on the anterior abdominal muscle, which is the rectus abdominal muscle. But along with that, along with the rectus abdominis, obliquus also gets involved. But in twisting crunches, we are giving more importance to the obliquus muscle. The another method of crunch, another variation in the crunch is a cable crunch, where a cable is used and a cable or a band is used, and the resistance or elasticity of the band or cable is used for to improve the resistance for the against the abdominal muscle work against this resistance. Another type of crunch is a bicycle type of crunch. In this crunch, there is movement of the leg like how the bicycle pedaling a bicycle motion or a bicycle pedal motion will be there, and the right arm goes towards the right elbow goes towards the left knee and left elbow goes towards the right knee. Another variation of the crunch is a ball crunch. It is done the same crunch done over a gym ball, and is another method of improving the tonicity and improving the strength of the abdominal muscle. And vertical leg crunch is another variation in the leg crunch. In vertical leg crunch, the leg will be there will be straightening up of the leg with the knees crossed and the upper torso is lifted. And another type of crunch is the long arm crunch. In this crunch, the person lies on the floor and with the legs with hands lifted or hands straight, and the person is doing the crunch. Another type of exercise which improves the abdominal strength is leg raise. It is one of the most commonly prescribed method for improving the abdominal strength, and all these exercises are to improve the tonicity and strength of the abdominal muscles. Now in this session we discussed about the different abdominal muscles, is the functions of this abdominal muscle, why the abdominal muscles are important in the body, and how it support the trunk and which are the movements of these muscles.